Hello and welcome to this press conference. Je vais maintenant passer la parole au ministre Leblanc pour commencer. I will now turn to Minister Leblanc to begin.
Alors, bon après-midi.
Good afternoon, everyone.
Today, I'm joined by Dr. New, Brigadier General Brody, and Madame Joëlle Paquette. Earlier this week, my colleague, Minister Gould, shared our government's commitment to helping developing countries in their vaccination efforts. C'est un privilège pour le Canada.
It's a privilege for Canada to have access to a safe vaccine. There are millions of people around the world who do not have access to safe and free vaccines. And it's not like here in Canada, but we can contribute to change that. We can take concrete action in order to help more people get vaccinated. Participating with UNICEF Canada, Give a Vaccine.
Canadians give to UNICEF Canada, our government will match it by providing funds and support towards global partners leading the vaccination efforts in the developing world. UNICEF Canada is co-leading global efforts to ensure countries are ready to introduce and deploy COVID-19 vaccines as soon as they become available. UNICEF Canada is making an unprecedented and historic effort to vaccinate people around the world with the largest and fastest procurement and supply operation ever undertaken. You can give a vax by visiting unicef.ca. Depuis le début de la pandémie,
Since the beginning of the pandemic, our government has supported Canadians and provinces. And Team Canada has been working to protect Canadians against COVID-19.
Deputy Prime Minister and Finance Minister Freeland said yesterday, we have delivered a one-time top-up of $5 billion through the Canada Health Transfer to help provinces and territories address the extreme pressures COVID-19 has put on our public healthcare systems. We are providing an additional $1 billion to support the successful vaccine rollout across the country so Canadians can receive their first and second doses as quickly as possible. And provinces and territories have done a terrific job in vaccinating their populations, and we thank them for doing so. I encourage you to get your first and second dose of vaccine as soon as you are eligible to receive it. Je voudrais maintenant inviter.
I would now like to invite Dr. New to speak. Dr. New, the floor is yours.
Merci. Thank you very much, Minister Leblanc. Bonjour à toutes et à tous.
Hello, everyone.
And in most health regions, COVID-19 disease activity remains at much reduced levels. Total active cases and average daily cases are 95% lower than the peak of the third wave, with less than 420 new cases being reported daily. Severity trends continue to decline, with, on average, 85% fewer people in hospitals with COVID-19 daily than at the peak of the third wave, and an average of 9 deaths reported daily. To date, almost 44 million doses of COVID-19 vaccines have been given in Canada, which equates to over 26 million, or 79% of people aged 12 years or older in Canada with at least one dose. Since this time last week, the proportion of people 12 years or older who are now fully vaccinated has increased from 44% to over 52% and climbing. As we continue to make good progress towards protecting people, livelihoods, and futures in Canada, we are aiming to build the vaccination firewall high enough to prevent severe illness outcomes and resume indoor education, business, and recreation this fall and winter. While we have many weeks of summer left to enjoy, it is also an important time to get ready for all of the opportunities that lie ahead of us. With under 8 weeks to go before Labor Day, getting vaccinated is one of the key preparations to not delay. In particular, for all those who are eligible but have yet to receive the vaccine, time is of the essence to get a first dose and be on track to be fully vaccinated by the fall. During these crucial next weeks, Public health at all levels are honing in on targeted supports to get more Canadians protected. The current epidemiology in Canada and worldwide shows that the vast majority of cases, hospitalizations, and deaths are occurring in unvaccinated people. Asymptomatic and mild illness is still a feature, particularly in younger people, but no age group is immune to severe illness due to COVID-19, and anyone can spread the illness to others, even if they aren't showing symptoms themselves. This is why vaccination is important for every eligible age group. In particular, as infection rates are still highest among those under 40 years of age in Canada, increasing vaccine coverage in younger age groups can have a big impact on COVID-19 control across communities. This is also needed for the protection of those who are at high risk, including those who can't be vaccinated, such as young children. For everyone who is not yet vaxxed to the max, this is a call for arms. You are needed in raising the firewall. Please step up, ask the questions you need answered, find the time, and seek out supports in your community to make this happen for you, and commit to join the collective Canadian effort to protect ourselves and those around us and get back to being indoors together this fall. Thank you. Merci. Miigwech. Bonjour à toutes et à tous. Je continue en français.
Go ahead.
Okay.
Oui, allez-y, Dr.
Go ahead, Dr. New. I apologize. Hello, everyone. Nationally, and in most health regions, COVID-19 disease activity remains at much reduced levels. Total active cases and average daily cases are 95% lower than the peak of the third wave, with less than 420 new cases being reported daily. Severity trends continue to decline, with, on average, 85% fewer people in hospitals with COVID-19 daily than at the peak of the third wave, and an average of 9 deaths reported daily. To date, almost 44 million doses of COVID-19 vaccines have been given in Canada, which equates to over 26 million, or 79% of people aged 12 years or older in Canada with at least one dose. Since this time last week, the proportion of people 12 years or older who are now fully vaccinated has increased from 44% to over 52% and climbing. As we continue to make good progress towards protecting people, livelihoods, and futures in Canada, we are aiming to build the vaccination firewall high enough to prevent severe illness outcomes and resume indoor education, business, and recreation this fall and winter. While we have many weeks of summer left to enjoy, it is also an important time to get ready for all the opportunities that lie ahead of us. With under 8 weeks to go before Labor Day, getting vaccinated is one of the key preparations to not delay. In particular, for all those who are eligible but have yet to receive the vaccine, time is of the essence to get a first dose and be on track to be fully vaccinated by the fall. During these crucial next weeks, public health at all levels are honing in on targeted supports to get more Canadians protected. The current epidemiology in Canada and worldwide shows that the vast majority of cases, hospitalizations, and deaths are occurring in unvaccinated people. Asymptomatic and mild illness is still a feature, particularly in younger people, but no age group is immune to severe illness due to COVID-19, and anyone can spread the illness to others, even if they aren't showing symptoms themselves. This is why vaccination is important for every eligible age group. In particular, as infection rates are still highest among those under 40 years of age in Canada, increasing vaccine coverage in younger age groups can have a big impact on COVID-19 control across communities. This is also needed for the protection of those who are at a high risk, including those who can't be vaccinated, such as young children. For everyone who is not yet vaxxed to the max, this is a call for arms. You are needed in raising the firewall. Please step up, ask the questions that you need answers to. Find the time and seek out supports in your community to make this happen for you, and commit to joining the collective Canadian effort to protect ourselves and those around us, and to get back indoors together this fall. Thank you. Merci. Miigwech.
Merci beaucoup. Merci beaucoup.
Thank you very much, Dr. New. We're now going to turn the floor to Brigadier General Brody.
Merci. To date, we have brought in almost 56 million doses of COVID-19 vaccines across Canada in support of provincial and territorial vaccination campaigns. This week's Pfizer-BioNTech deliveries of 1.4 million doses were completed yesterday. We expect to receive large shipments over the next 2 weeks to meet our Pfizer-BioNTech forecast of 9.1 million doses for this month. We will also be receiving 2.1 million Pfizer-BioNTech doses the first week of August. Additional delivery schedules for both Pfizer-BioNTech and Moderna are being discussed, and more information will be forthcoming in the weeks ahead. In the coming weeks, we will cross a symbolic threshold of 66 million doses, signaling that there are enough doses in Canada to vaccinate every currently eligible Canadian. As we pivot from limited supply to sufficient supply, we are implementing a more nuanced approach to ensure that the vaccines are stewarded in a manner that best supports Canada's enduring domestic needs, as well as optimizes options for supporting global vaccination efforts. As briefed in previous weeks, we will continue to offer provinces the option to hold doses from their initial rollout allocations in central inventory, along with a small, carefully curated strategic vaccine supply at the federal level to meet emerging needs. This allows provinces and territories ready access to vaccines as they need them in the months ahead. We have traveled far on this COVID-19 vaccine distribution journey since December 2020. I am tremendously proud of the work of the team and our partners to date, and we will continue to adapt our distribution and inventory management approach to best support Canada's COVID-19 vaccination program. À ce jour, nous avons...
To date, we have brought in almost 56 million COVID-19 vaccine doses across Canada in support of provincial and territorial vaccination campaigns. This week's Pfizer-BioNTech deliveries of 1.4 million doses were completed yesterday. We expect to receive significant doses of Pfizer-BioNTech in the next 2 weeks and 9.1 million doses of Pfizer-BioNTech for this month. We will also be receiving 2.1 million Pfizer-BioNTech doses the first week of August. Additional delivery schedules for both Pfizer and Moderna are being discussed. More information will be forthcoming in the weeks ahead. In the coming weeks, we will cross a symbolic threshold of 66 million doses, signaling that there are enough doses in Canada to vaccinate every currently eligible Canadian. As we pivot from limited supply to sufficient supply, we are implementing a more nuanced approach to ensure that vaccines are stewarded in a manner that best supports Canada's enduring domestic needs, as well as optimizes options for supporting global vaccination efforts. As briefed in previous weeks, we will continue to offer provinces the option to hold doses from their initial rollout allocations in our federal supply, as well as a small, carefully curated strategic vaccine supply at the federal level to meet emerging needs. This allows provinces and territories ready access to vaccines as they need them in the months ahead. We have traveled far on this COVID-19 vaccine distribution journey since December 2020. I am tremendously proud of the work of the team and our partners to date. We will continue to adapt our distribution and supply management approach to best support Canada's COVID-19 vaccine program. Thank you. Miigwech.
Thank you very much, General Brody. Alors, Jean-Sébastien, à vous, on est...
Jean-Sébastien, the floor is yours. We will be more than happy to answer questions.
Any questions? So, Jean-Sébastien, over to you.
Merci beaucoup, Monsieur le Ministre. Donc, nous allons maintenant débuter la période de questions. Ministers, the Brigadier General and Dr. New will now be happy to take your questions. And I should also say that Madame Paquette from PSPC is there to take your questions as well. So as usual, it will be one question and one follow-up. Comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Je vais maintenant passer la parole à l'opératrice pour la première question.
Thank you. Merci. Please press star 1 at this time. If you have a question, veuillez appuyer sur étoile 1 maintenant pour toute question. Our first question, notre première question, nous vient de Mia Rabson with the Canadian Press. Please go ahead. À vous la parole.
Nuanced approach to distributing vaccines. I'm just wondering if you can give a bit more information about what that means, particularly as it relates to helping global supply of vaccines and what sort of that entails, and how many doses Canada sort of is now holding back and has not distributed to the provinces.
Ms. Rabson, it's Dominic LeBlanc. You were cut off. I couldn't hear the very first couple of sentences of your question. Perhaps, Edith, I just want to make sure it sounded like General Brody or Dr. New could give you the precisions you're looking for. Perhaps you could just pose the question. I want to make sure we understood the first couple of sentences.
Yes, for sure. I'm just wanting a bit more detail on this nuanced approach that Brigadier General Brody talked about in terms of distribution as it relates to helping the global supplies.
So, General, go ahead, and if Dr. New wants to add something.
Thank you. What we're doing now is managing our vaccine supply in a very strategic way that allows us to ensure that the provinces have the doses that they need on hand and readily accessible, while minimizing wastage and optimizing our ability to transition doses for global donation as the provinces signal that they no longer have a requirement for those doses. And I think you had asked a question regarding how many doses are currently sitting in central inventory. So at this point in time, we're managing about 2 million doses on behalf of the provinces. So these are doses from their initial deployment allocations that they've indicated that they would like us to manage centrally so that they can pull them down at the time and place of their choosing as their programs indicate that they're ready to accept those doses. Thank you.
Thank you. And just wanted to clarify that 2 million is on top of the Federal Reserve doses you talked about. But this is probably a question for Minister LeBlanc. Are we planning to stockpile doses of vaccine in Canada, sort of awaiting kids being approved later this year, rather than donating them to countries who might be able to use them immediately?
So thank you for the question. I'll offer some comments, and perhaps Dr. New or others are in a position to add something. We have said from the very beginning, the most important responsibility we as a national government have is to ensure that we quickly, safely, and successfully procure the necessary vaccine doses to ensure that every eligible Canadian who wants one can have one as quickly as possible. And from the numbers that General Brody shared or Dr. New, I think you can conclude, as we have, that the vaccine deployment effort has been successful. Our provincial and territorial partners have done a very considerable job, very effective job in immunizing their populations. We have also said, and we've seen months ago, some of the challenges of a global supply chain and the global pressure on these large pharmaceutical companies in terms of procurement. So we will be very prudent in ensuring that we always have access to all the necessary vaccines to immunize Canadians. And your question, I think, is very valid. If, for example, Health Canada grants approval based on some trials that are underway now for younger persons to be vaccinated, we would obviously want to very quickly have the vaccines necessary for provinces and territories to begin immunizing younger people. Dr. New said that Labor Day is less than 8 weeks away. Kids will be going to school. Obviously, if the regulator, if Health Canada determines that it's safe to administer vaccines to persons younger than 12 years old, our job as a national government is to ensure that we have available those vaccines to protect Canadians. So that will always be our primary focus. We will never do anything that will jeopardize our ability to have quickly and safely access to all the vaccines necessary to immunize any eligible Canadian. But as Minister Gould and the Prime Minister spoke about earlier this week, we also accept our responsibility to work with international partners to help distribute vaccines to developing countries. Canada has already made a very significant contribution, and we're always looking at ways to do more. I think General Brody said it very well. The primary responsibility is to ensure that we're able to vaccinate Canadians, but we want to do so in a thoughtful way to ensure that if we're in a position to increase our donations to developing countries, to facilities like COVAX, working with UNICEF, a number of other partners, we're in a position to do so. But our focus always has been and must remain ensuring that we first and foremost have all the vaccines necessary to quickly immunize Canadians at the very moment that Health Canada says it's appropriate to do so. But perhaps Dr. New wants to add something, or General Brody?
It's Dr. New. Maybe the only other point I would make is that obviously, as Minister LeBlanc and others have said, is that yes, we're keeping an eye on in terms of the issue of approval of a vaccine for children 12 and under. Certainly, that's something we're monitoring. Obviously, there's clinical trials underway. There's obviously a submission that needs to be made to our regulator, Health Canada, and then obviously their due diligence in terms of looking through the data and then subsequently, hopefully, approving the vaccine. But I think we can't also forget that we're in the here and now. And right now, although we're doing very well, there's still room for improvement. If you look at the percentage of Canadians who've received one dose, it's good overall. You know, we're about 80%, but that still means that 20% of eligible Canadians who are unvaccinated with not even a single dose. And that's something that I think all of the provinces, territories, and ourselves included at the federal level are really looking at. What are the issues? What are the barriers? Be it accessibility, be it maybe some hesitation based on maybe some questions which maybe are unanswered for individuals at maybe a personal level. All those issues, I think, are being looked at, and hopefully, I think we're addressing them in many different ways to try and get the vaccination rate up for that one dose, and obviously then for the second dose as well. So you're right; it's important to look at the future and what we might do for children, young children. But in the meantime, I think we really need to still focus on those Canadians who are eligible for vaccination and who still haven't availed themselves of even just one dose. Thank you.
Thank you, Dr. New. Operator, over to you for the next question. Donc, opératrice, à vous pour la prochaine question.
Thank you. Merci. Our next question, notre prochaine question, is from Stephanie Levitz with the Toronto Star. Please go ahead. À vous la parole.
Good afternoon. Thank you for taking our questions. My first is for both Minister LeBlanc and I guess Dr. New. What are the specific conditions in Canada you want to see before easing more of the restrictions at the border?
So Stephanie, thank you for the question, and Dr. New can add some information around the epidemiological trends that he and Dr. Tam and provincial and territorial public health officers are following. We have said from the very beginning that the principal job for the national government is to ensure we have at the borders in place all measures necessary to protect Canadians. We have, I think, from the beginning, put a series of layered measures that we've adjusted over time as we receive new information, as different global circumstances require. We have shown that we're prepared to add additional layers of protection when it's appropriate to do so. We've also said that we understand very, very much Canadians' desire to be able to travel again, to see family members, to resume some of the activities that were so important before COVID-19, before the pandemic, and that's why we eased some measures in a balanced, thoughtful way on July 5th, and we have said we're prepared to take additional progressive steps over the coming weeks and months as it's safe to do so. The Prime Minister is convening later today a discussion with First Ministers, with Premiers. We are going to talk about further measures at international borders, and we'll have more to say about specific measures over the coming days and weeks. But we think it's important to remind Canadians that there are still some significant challenges with COVID-19. Vaccinations are by far the best protection that people can have. But we will, and we understand from the tourism sector, we understand from the hospitality industry, and the general desire of Canadians, as I said, to be able to travel in a safe and appropriate way. And we're going to continue to work with public health authorities, provinces and territories, as we evolve the posture at the border. And we will have, I think, more to say in the coming days around the appropriate phased relaxation of certain measures. But perhaps Dr. New can offer some specifics in terms of the epidemiological trends that they're looking for as they advise the government on the appropriate steps to take.
Well, thank you very much, Minister LeBlanc. And you're right. What we're doing, obviously, at a technical level from a public health perspective is looking very carefully at the data, epidemiological indicators, and so on. Obviously, the vaccination rate among the Canadian population is a very important metric to follow, because the more protected we are as an entire population, the more resilient we would be in terms of any potential, what we call maybe a potential importation of cases. So, as I mentioned earlier, we're pretty good right now with 80% of Canadians, eligible Canadians, having received one dose, but we could do better. And then we're also having to ramp up, obviously, with our second dose coverage. So beyond the vaccination, the indicators we're looking for are really in terms of seeing where we're at with respect to severe illness and death. And as I said, that situation looks good. Certainly metrics like hospitalizations and deaths are all trending downwards in a very, I think, good and dramatic fashion, which I think speaks to the importance and the sort of the effectiveness of the vaccines overall. But those are things that we need to keep monitoring. And of course, the wild card, as they say, that everyone's well aware of is the variants. To date, the variants have shown, many of them have shown to be more transmissible, but overall, the evidence that we've seen to date showed that they haven't really been more severe in terms of causing a more severe outcomes overall compared to, let's say, the original strain of the COVID-19 virus. So that's something to keep an eye on. And we're also continuing to monitor in terms of vaccine effectiveness. What we're looking for is what we call vaccine escape, or the potential impact of the variants to reduce sort of the overall effectiveness of the vaccine. And we haven't seen that to date either. But like I say, we continue to follow the data and the evidence. And I think the last point I would make is that it's a bit of a cautionary tale. We always look over to other countries and see what they're experiences. And as you can see, even now in Europe, as they've opened up to varying degrees in different countries, there's been different experiences. And even in countries that have had good success with their vaccination programs, we're seeing a resurgence in cases, and countries are having to reapply and sort of go back down into a sort of stricter, I don't want to say full lockdown, but certainly putting a stricter public health measures back into place. So I think all of that is sort of a part of the mix as we look at the data and give our best advice to the government.
Thank you. Just as my follow-up, I guess, speaking a bit about the data, there seems to be a lot of science now suggesting that the 14-day quarantine is no longer required, that you can achieve the same effect if you quarantine for 7 days and just make sure you're testing people. If they're asymptomatic, they should probably be allowed to go. Do you anticipate at any point updating the guidance, whether at the border or just broadly for the nation, to remove the 14-day quarantine, especially as vaccination rates continue to increase, and especially for children?
Dr. New?
Wow, there's lots in there. So let me first start with one point, is that in terms of the border stance and the quarantine period, I think there's two elements that I think maybe might be a bit confusing for the general public. One is what we call the period of infectiousness. So for people who actually have COVID-19, actually are considered an active case, certainly from the evidence and data to date, and that's what by and large the provinces and territories are looking at, is that a person who actually has COVID-19 is considered infectious for up to about 10 days after the initial onset of symptoms, or at least that initial positive laboratory test result. And so after 10 days, that person could be considered non-infectious to others. The 14 days in the quarantine, I think, speaks to what we call the incubation period. So if someone is actually exposed to the virus, it can take up to, certainly from the evidence we've seen to date, up to 14 days for the person to actually develop symptoms, and obviously then be able to be infectious to others. You're right. There's obviously, like I say, a bit of what we call a bell curve to that, where most people will tend to, with their incubation period, declare their symptoms, become symptomatic and infectious probably earlier, probably 7-10 days. But there is obviously a certain percentage of individuals who will still go on to be infectious later in the incubation period, be it day 12, 13, and so on. So in some ways, it becomes an issue of risk tolerance and risk management. The other aspect to consider is that no vaccine, as we know, is 100% effective. So even for fully vaccinated individuals, it's still possible that for a given individual, you could still be, transmitting the virus to others. And so all that's been taken into account. We're risk managing it. We're looking at what is reasonable from a policy perspective. We've given advice to the government, and you can see that we're changing sort of the policy at the border with respect to fully vaccinated travelers, taking into account all of the science. But to your point about the quarantine period, I think certainly from a federal perspective at this point, looking at metrics such as the volumes of incoming travelers, looking at vaccination status and potential for those individuals, some of them at least to declare their symptoms, up to the full 14 days. That's all part of the mix. And I would say certainly domestically, in terms of the quarantine period, I would leave that to provincial and territorial authorities in terms of what the policies they actually have in place for managing exposed people and how they manage those within potential incubation period of up to 14 days. Thank you.
Thank you, Dr. New. Operator, over to you for the next question. Opératrice, à vous pour la prochaine question.
Thank you. Merci. Our next question, notre prochaine question, is from Mackenzie Gray with CTV News. Please go ahead. À vous la parole.
Hi, my first question is for Brigadier General Brody. Obviously, the government was able to bring in a substantial number of Moderna doses in the final weeks of June and the first week of July, but right now there's no delivery date for further Moderna doses, and we're seeing a number of Canadians, either walking out of line when they hear it's Moderna and wanting to get Pfizer. Is there any contemplation right now to hold on getting further Moderna doses to work through the kind of glut of Moderna we have in the country right now?
We're working closely with the manufacturer and with provinces and territories to confirm their requirements and to confirm upcoming shipments so that we match as best as possible the demands of the provinces with a supply that we bring in. We do have signals from Moderna of upcoming shipments to complete their July shipments, and we continue to confirm our shipments for Pfizer for the upcoming weeks as well. So we have coming in next week on the Pfizer front, upwards of 3.1 million doses, 3.6 million doses at the end of July, and we continue to work closely with our partners and with the provinces to match demand with supply.
Follow-up questions for Dr. New on booster shots. I'd like to hear if there's a timeline that you think a booster shot would be needed. And to me, it seems clear that the procurement minister at least seems to be needing booster shots because she bought booster shots for the next 2 years. Did she ask you or Dr. Tam about if you think Canadians will need booster shots in the coming months or years?
Okay, well, thank you very much for the question. I think in some ways it's always important to plan ahead, but I would think at the present time, as I've stated before, the current objective is to hopefully have a fully vaccinated Canadian population with the 2 doses. And although we've made good progress, I think we still have some work to do in terms of the fact that we only have 80% of Canadians having received 1 dose. And obviously with those receiving second dose, we're 50% and over and creeping up, but I think we could obviously do better. So putting that aside, the issue of booster doses is something that's still, I think, a live issue that's evolving as all of us here in Canada, but also around the world, are continuing to look at the data and sort of the real life experience of what's happening. For those who have received the vaccine, it seems that the protection is long lasting. And we also know from what we call principles of vaccinology and immunology that even if you can't actually find markers such as sort of antibodies and so on in an individual who's been vaccinated, a certain period of time after the vaccination, the body is very good in terms of the immune system with what we call a certain type of immunological memory. And if they are then stimulated by a sort of exposure to the virus in the future, maybe many months down the road, the body kicks in and then actually mounts an effective immune response. So those are the types of scientific questions that are still, I think, being examined. But it is I think reasonable to think and plan for the fact that yes, down the road there's potentially a need for booster doses. What the need is in terms of frequency of doses, how to what degree maybe the vaccine needs to be modified and so on. Those are still outstanding questions. So at the present time, I think let's focus on getting a fully vaccinated Canadian population, and let's continue to follow the science in terms of a need for a booster dose down the road.
Thank you, Dr. New. Operator, next question. Opératrice, prochaine question.
Thank you. Merci. Our next question, notre prochaine question, is from John Paul Tasker with CBC News. Please go ahead. À vous la parole.
Oh, hi, guys. Yeah, this is a question for Dr. New. We've heard from a number of people who are very disappointed that the Johnson & Johnson vaccine has been essentially shelved. There's no further deliveries planned, and you folks have indicated there's very little demand from the provinces for this product. What do you say to those vaccine holdouts who are really much more comfortable with the J&J product because it uses a more conventional vaccine technology than the mRNA shots that are in wide circulation right now?
Yeah, thank you very much for the question. It's Dr. New. What I would say is that certainly our National Advisory Committee Immunization has pronounced on all of the vaccines which are obviously currently authorized for use in Canada. But as you indicated, at the end of the day, it really is for provincial and territorial authorities to look at the recommendations from NACI, but also to look at their context, look at also their view of what makes sense in terms of their vaccination programs. And as you indicated, the demand has been there for the mRNA vaccines. I would say certainly the present time is sort of the workhorse in terms of their vaccination programs. And based on the evidence to date, certainly very good results in terms of vaccine effectiveness for the vaccines that are currently in use by the provincial and territorial vaccination programs. So I can't say much more than that. You can't force provinces, territories, or any individual to take any certain vaccine. I think it is a bit of a sort of a demand issue for those individuals that are looking for a certain type of vaccine. I would still say, hey, it's always important to listen to your local public health authority. And also, if you have any questions, go to your healthcare provider. I'm sure they can provide you with the information you need to make an informed decision. And at the end of the day, as you indicated, if that's the kind of hesitancy, if I can call it that, for individuals, just because they have maybe some questions about the relative merits of one vaccine versus another, I think that's fair game. Go ahead and please ask those questions. And if it then leads you to be more comfortable and then get vaccinated, that's all what we're all looking for in the end. Thank you.
Yeah, thanks, Dr. New. Okay, so this is a question for Mr. LeBlanc. We're getting early reports of some Canadian travelers being told by other countries that they're not considered fully vaccinated because they've had doses of two different vaccine products, because they've mixed and matched. Can you tell us what the government is doing, what exactly the government is doing to make sure that this doesn't become a problem, or more of a problem, I guess, for would-be travelers down the road?
Thank you for the question. I offer some comments, and perhaps Dr. New could answer in terms of the science of mixing two different vaccines. We as a government obviously follow the advice of regulators, Health Canada, and the National Advisory Committee on Immunization in terms of what's safe and appropriate for Canadians. But we also work with allies like the United States, obviously, but European countries as well, in sharing data, in working with them on the best immunization strategies. So we understand the concern that Canadians have around international travel. We also think it's important for Canadians to, as Dr. New just said, follow the advice of local public health authorities and their healthcare providers to ensure that they themselves are immunized in the best way possible as quickly as possible. And we'll continue to have conversations and to work closely with European authorities, with American authorities, on the best way to ensure that Canadians who are able to travel safely to those countries can do so. But the entire world is faced with the circumstance of reopening at various stages in various ways international travel and international borders. So the question of how to safely allow Canadians to travel again is one that's going to be with us for a number of weeks and months. As you know, the Government of Canada is working with provinces and territories on some proof of vaccination to help Canadians with respect to international travel. We have an ongoing conversation which is very constructive with provinces and territories. My colleague, the Minister of Immigration and Citizenship and Refugees, is leading an effort with the Public Health Agency of Canada to develop the appropriate proof of vaccine credential, which will assist Canadians in international travel. So over the coming weeks and months, we'll have more details and information on that. But we also respect the jurisdictions of other countries in terms of their own international borders. So it can and should be a collaborative effort between Canada and partner countries and allies. We expect it to be so. And the conversations that we're having, for example, with the United States around the Canada-US border are ongoing and are extensive. And these are the kind of issues that will obviously be raised and we'll discuss with allies as we go forward over the coming weeks and months. But perhaps Dr. New on the science of mixing vaccines and perhaps what some international partners are saying in conversations that I'm sure he's having with international colleagues as well.
Well, thank you very much, Minister LeBlanc. There's not much to add to what you've already said with a very comprehensive answer. I would say from a, quote, the scientific public health perspective, I think that here in Canada, we're fortunate. We actually have a sort of a suite of vaccines that we're able to offer Canadians compared to many other countries which don't really have that option. And so looking at the issue, as you say, of mixing and matching, certainly it's been based on very thoughtful analysis of the data available to date in various studies. And I think, as we stated at previous press conferences, the data is very compelling. If you look at various studies looking at certain groups like healthcare workers that received initially a dose of vaccine of one type and then getting a different vaccine for their second dose, that the results actually are much better than what we call a homologous sort of a schedule of receiving the same vaccine for both the first and second doses. So I think in terms of the immune response, very good results and from those studies. And based on that, that's why NACI, I think, in terms of their deliberations, looking at the data, made that recommendation. And so here we are in Canada, and I think, as they say, the proof's in the pudding. You look at the results of our vaccine rollout, and the fact is that our case counts, severe illness, hospitalization, deaths are declining dramatically, I would say. And if you look at things such as outbreaks in high-risk settings, such as nursing homes and so on, they're really, very, very, very few, if any. I'm not aware of any major outbreaks per se, compared to what obviously we experienced with our previous waves here in Canada. So overall, I say from a public health scientific perspective, I think we've done the right thing to date. Certainly, the evidence is there in terms of what's happening in Canada. And as Minister LeBlanc said, it's more a matter of discussing with other countries in terms of say more standardized approach to looking at what vaccines are sort of accepted, but also even in terms of the dosing schedule of the vaccines that would meet the needs requirements of various countries around the world, so that in the end of the day, it would make sense that it's simpler for travelers from all countries to be able to go from country A to country B. Having said that, at the present time, we're still not recommending people to travel outside of Canada, obviously for non-essential purposes. I think if you look at the situation in many countries, even those that have good vaccination programs, they're having resurgences. There's the emergence of variants, and so Canadians who go outside of Canada, I think there's still a certain level of risk that you need to be aware of. And I think for the time being, I would myself personally restrict my any travel to within Canada. Obviously, being double vaccinated and looking and following the advice of local officials in whatever jurisdiction you may be considering traveling to, especially now with the summer holidays. Thank you.
Thank you, Dr. Liu. Operator, over to you for the next question. Donc, opératrice, à vous pour la prochaine question.
Thank you. Merci. Our next question, notre prochaine question, is from Charlie Pinkerton with iPolitics. Please go ahead. À vous la parole.
Good afternoon, all. My questions will probably be for Minister LeBlanc or Dr. Liu as well. The Prime Minister said this morning on a French radio station that in the coming weeks, not days, the government will have more updates on loosening travel restrictions. Mr. LeBlanc, you've obviously said different today, referring to days, and mentioning that the Prime Minister is talking to the premiers about this tonight. So the sort of deadline that's coming up is July 21st, only 6 days away, which is when the border closure agreement with the U.S. is set to expire, and other travel restrictions are set to expire as of right now. We've heard from the Border Security Minister before that 75% of all Canadians being fully vaccinated is what he wants to see before normal travel can resume. We're obviously not quite there yet in Canada, nor will we be by July 21st. But I don't think there's an expectation that normal travel is the next step in the removal of travel restrictions. So my question is, should those who are anticipating or looking forward to traveling in a less restrictive way than is currently still look at July 21st as a date for when there might be easier travel, or should they sort of kiss that date goodbye as to when things might be drawn back a little bit?
Thanks. I'll offer some comments, and Dr. New can obviously add something as well. I think Dr. New just said something significant in terms of the travel advisories that remain in effect for Canadians around international travel. Vaccination rates have to continue to go up as they are. We're very encouraged, obviously, by the last number of weeks, but that trend needs to continue. We, as a government, have said that we're constantly reviewing the measures at the border, receiving advice from Dr. New, from Dr. Tam, from public health experts across the country, and are prepared to make the changes that are appropriate based on the medical and scientific advice that we receive. The First Minister's meetings have, for many months, included discussions and conversations with First Ministers around public health measures, including at the international borders. So it's part of an ongoing conversation that we're having with provinces and territories. We obviously solicit their views. I wrote some weeks ago to all premiers asking them to share with us their views on the appropriate phased approach at Canada's international borders. There's obviously also a circumstance, as Dr. New said, in terms of potential variants, where we have to take different measures at the border. So none of these decisions are simple or one-dimensional. The Prime Minister said over the coming weeks we'll have something to say. That's right. I may have said days, but if I meant 14 or 21 days, that could be 2 or 3 weeks. These are ongoing conversations. We do recognize, however, that Canadians are anxious, and particularly in the domestic context, to be able to once again see family members and travel. We hope that they can safely do so over the nice weeks of the summer ahead of us. You mentioned the July 21st Order in Council date. We have in the past used that rollover, the renewal of the orders in council, which give legal authorities necessary for the border measures, can also set a coming into force date for some weeks hence. So we can renew the July 21st orders in council, and we can, based on certain metrics and certain advice that we receive, set dates where in the future where border measures may evolve. Those are the exact kind of discussions that the COVID Cabinet Committee is having this week, and those discussions are obviously ongoing with the benefit of the advice from Dr. New and Dr. Tam, and again this evening from First Minister. So we'll have more to say when it's appropriate to do so, but perhaps Dr. New wants to add something in terms of measures again at the border and how scientific and epidemiological indicators help inform those decisions.
Well, thank you very much, Mr. LeBlanc. I would just add that you're right. We continue to monitor the science, the data, the experience from other countries, and there's a lot that goes into the mix. You know, even looking at the indicators, the data in terms of case rates, hospitalizations, what the impact might be of variants, and so on. We're using modeling and other types of expertise to give us sort of the best understanding of what may potentially happen, depending on what policies are put in place at the border. And then we give our best advice, obviously a cabinet confidence to our ministers, and then at the end of the day, as we all know, it's elected officials that make the final decision. So that's how I would frame in terms of our role and what we do as public health experts. Thank you.
Okay, thanks. My second question, Dr. New, this is probably best for you. A few weeks ago, Ocugen, I believe is the name of the company, excuse me for pronouncing it wrong if I did, through its Canadian partner, Vaccination, submitted an application for approval for its COVID vaccine, which is being used in other countries, but our federal government has not purchased itself. So far, travelers that can return to Canada while dodging quarantine can only do so when they've been fully vaccinated with a Health Canada approved vaccine. So I'm wondering, to your knowledge, is this why this company has applied for approval? So recipients of its vaccine whether they're Canadian right now or later on, presumably they would be able to come to Canada without as strict restrictions. And is this something that other companies, vaccine makers, even if Canada hasn't bought their vaccine, should be doing to make things easier for those who have received it?
Okay, well, thank you very much for the question. I think if I were to distill it down, I think it's not maybe specifically in terms of any single company, putting a submission to Health Canada as our regulator. I think the issue really is about when we talk about fully vaccinated individuals and what would be sort of acceptable from a Canadian perspective in terms of recognizing full vaccination with any type of vaccine for those travelers coming to Canada, and that's a live issue right now. And I think with the previous question, we're having discussions actively, obviously at the international level. I think in Canada we're looking very closely. Right now, obviously, the posture is that it's with what we call Health Canada approved vaccines. But I think certainly we're thinking that it's beyond that. That we need to look and think globally and look at maybe what's happening at the international level with the WHO and the so-called WHO approved list of sort of approved vaccines. And so in terms of accepting vaccines that have also been, let's say, approved by a WHO, that's certainly part of our thinking consideration as we move forward. So I think rather than getting to the ins and outs of individual companies making applications to Health Canada, of course, there's always a regulatory aspect, and at the end of the day, we need to make sure that it's aligned with our regulatory regimes to the extent that it's needed. But I think conceptually, I would say that I think we're looking more now at sort of a more international collaboration and also international consensus in terms of what vaccines could or should be accepted by all countries for travelers who have been vaccinated with one of those, let's say, in this case, WHO-approved vaccines.
Thank you.
Thank you, Dr. New. And operator, I'll pass it over to you for the last question. Donc, Béatrice, à vous pour la dernière question aujourd'hui.
Thank you. Merci. Our last question, la dernière question, is from Shai Davidi with Sportsnet. Please go ahead. À vous la parole.
Thank you. This question is for Dr. New and Minister LeBlanc. If you have anything to add, please do. I'm wondering where the Blue Jays application for a national interest exemption currently lies and what concerns may prevent it from gaining approval.
It's Dr. New. Go ahead. Sorry.
Go ahead, Dr. New.
I'm just going to say, Minister LeBlanc, that yes, I've been part of obviously a team at the Public Health Agency, but obviously it's not just the Public Health Agency alone, but other departments as well. But we have reviewed the submission by the Blue Jays for that national interest exemption, looking at it from a sort of public health perspective, as we always do for all of these other submissions. And as you can appreciate, what we see is that the submission by the Blue Jays would look at, quote, resuming a certain point, sort of the regular season based in Toronto, which would then obviously involve cross-border travel for, homestands and then going for road trips as well. From a pure sort of assessment of the protocols, there's been a lot of good back and forth because based on their initial submission of protocols, we obviously have had some recommendations to be sort of made to back to the Blue Jays, and they've been very open and willing to take those recommendations on. And I would say that it's all done in sort of good faith. I would also say it's not as simple as what does this mean for the Blue Jay players, because obviously it's not the players themselves alone, it's their whole entourage. You got maybe families involved. There's also looking at making sure that provincial and local authorities are also supportive and so on. So I would say it's trending in a very good direction at this point. We're looking at sort of I would say last details, but at this point I would say there aren't any showstoppers or anything that we really can't sort of continue to discuss and move forward on. So I can't give you a date in terms of when a possible decision would be made for the NIE or national interest exemption, but I would say that in terms of the discussions from a public health perspective, they've been going very well. Yeah,
and perhaps I could just add, Dr. New, I think gave the detail of the kind of work that the Public Health Agency does. In this case, with the Blue Jays, they had done very good work with the National Hockey League in the past. We saw, for example, the Calgary Stampede. Again, another example where through back and forth with the particular sports organizations and all of the appropriate testing and isolation protocols in place, these things can be done safely. And the government recognizes that Canadians, I've watched a number of the Blue Jays games on your network, and I can imagine that if you're lucky enough to be in Toronto and to be able to watch them play in person, it would certainly be of interest to many, many Canadians. And that's why the government will continue to work, as Dr. New properly described, in a way that is always guided by what's necessary to protect the health and safety of Canadians. We're lucky that the Blue Jays organization, like other large sports organizations, very much want to have a collaborative, rigorous system in place that protects not only their players and personnel, but Canadians as well. But there's obviously a conversation that has to happen with provincial authorities, as Dr. New said, and in the case of Toronto, municipal health authorities as well. So at any time we've issued the national interest exemptions, it's because we've had the support and the collaboration of provincial authorities and municipal authorities in some cases as well. So those conversations would be ongoing, and I too am encouraged by Dr. New's answer that he just gave.
And just as a follow-up, the Blue Jays, to my understanding, require a decision by tomorrow in order to host their July 30th homestand here in Toronto. Otherwise, they would be looking forward to an August 20th date. Is there a possibility for them to get an answer in time for that? And if not, you mentioned sort of no specific timeline, but you're working towards that. What are the final pieces that have to fall into place if you can offer any specifics on that?
Thank you very much for the question. I can't offer specifics, but the timelines you've mentioned, yes, we're very aware, and I think everyone's making all their best possible efforts to meet those timelines. In essence, we recognize the imperative for the Blue Jays to get sort of a fair advance sort of notice so that they can obviously do their planning, logistics, for the players, their families, and so on. So I would say that we recognize what's in play, and we're making our best possible efforts to render a decision in the right time frame that would be, I think, a good decision and a well received decision by all.
Thank you, Dr. Liu. Donc, voilà qui met fin à cette conférence de presse. Merci d'avoir été parmi nous. That marks the end of the press conference. Thank you for being with us today. Bonne journée. Have a great day.